Hello students, coming back with the same topic, that is adverse drug reactions. As you know, in the last class we have discussed the 5 categories of adverse drug reaction. So today we are going to discuss the rest of the categories of adverse drug reaction and we are going to complete this topic. So now coming with the topic, that is drug allergy. Often this term drug allergy or allergy is very common to all of you, right? So you often know that which substance, which food, which drug can cause allergies to you. Many people often say don't have prawns because prawn may have a allergic sense. In many people happens, even for brinjal and all. So what is allergy? Allergy is basically the hypersensitivity reaction that occurs. So here you just make that drug hypersensitivity. This is the important key point. So what I said, drug allergy means drug hypersensitivity, which means what? Immunologically, what happens? Medicated or mediated reactions, that is immune reactions, which is producing the stereotype symptoms unrelated to the pharmacodynamics of the profile of the drug. So what do we understand by this? We understand that first point is drugs and hypersensitivity. This is the first point we all know. Next you come immunologically mediated reaction, means T cells, B cells, right? So there what happened, there is a stereotype symptoms are occurring. Stereotype symptoms means often you will see many people due to allergic reactions may result in rashes, okay? Rashes, or even they may have itchings, or they may have scars on their skin. So those are the reactions of this allergy. Next is what? Generally occur with smaller doses, means what? Allergy is something that even occurs at smaller doses also, means it is not mandatory that allergy have to cross the therapeutic window. Even within the therapeutic window, if it is having a hypersensitivity reaction, then it can cause a adverse drug reaction. So here we are cited with few of the examples, that is, now allergy is basically 4 types, that is type 1, type 2, type 3 and type 4. So based on this type of allergies, here I have divided it into 4 types with its characteristics, that is immediate anaphylactic, cytotoxic antibody, then serum sickness, then delayed hypersensitivity. So based on all this, now I have made the following classification. So first we are going to start with the type 1. Type 1, what is been said? It is immediate and it is anaphylactic. Anaphylactic means it is allergic or it is hypersensitivity. For example, here we have cited the penicillin. Penicillin is causing what? Anaphylaxis. Similarly, the type 2 of allergic reaction, that is cytotoxic antibody. Here what is being produced? IgG and IgM. That is a humoral cytotoxic antibody is being produced. So here the example we have cited is methyl dopa, hemolytic, anemia, immunity. Type 3 is the serum sickness. This is also producing the same antibody. And here what is this? Antigen antibody complex, and example is procainamide induced lupus. So lupus is forming, that is procainamide induced. And the last type is what? Last type is delayed hypersensitivity. It is due to the T cell immunity, means T cells, cell mediated immunity. T cell mediates what? Cell mediated, so it is being caused by that. And what is its example? That is contact dermatitis is being caused, okay? So this way we can say that how allergy is related to adverse drug reaction, okay? Next is photosensitivity reaction. This is also another category which falls under the categorization of ADR. So here what is being said, that cutaneous reactions is causing what? Cutaneous reactions causing what? Resulting from drug-induced sensitization on the skin to UV radiation. The reactions are two types. So, the word itself, photosensitivity, photo means light and sensitivity means penetration on the skin. So, here what type of reaction is occurring? Cutaneous reaction is occurring. How cutaneous reaction is occurring? When a drug is being induced its sensitization to the skin and it is due to the UV radiation. Now this type of cutaneous reaction can be further classified to two main types. One is phototoxic and one is photoallergic. Now let me highlight these 2 points. So one is phototoxic and one is photoallergic. So now what happens in phototoxic, what happens? A drug or a metabolite gets what? It gets accumulates on the skin, it absorbs the light and it undergoes the photochemical reactions. Means what? The idea is that phototoxic means toxicity is caused by photon. Photon means the ray of light which is penetrating the skin, causing tissue damage and causing the photochemical reactions. Example, you can say sunburn like edema, blistering, hyperpigmentation. These are very common examples. Often you are said when many people go to beach side, you are said that please take proper protection. Please take the sun protecting factors, means the SPF, that is the sunscreens. Why? Because it may cause certain damages like this, and those type of reactions are known as phototoxic reactions. Now coming to the next, that is photoallergic, and here are the drugs. Here I said at the beginning photo, at the same time the drug that induced the sensitization, that is the causing phototoxic sensitization. Next is the photoallergic. For this photoallergic reactions, what is there? It is that the drug or its metabolite, it induces a cell-mediated immune response. So for producing that cell-mediated immune response, what we can see is that which an exposure of the light, that is when your hand is being exposed to light, what happens? It produces a popular or eczematous contact or dermatitis like picture. So often I think you have seen that what is eczema. Eczema is a black dark patch of skin that may occur due to photoallergic reaction or maybe certain other types of allergic reactions. So here what is saying, those photoallergic reactions, those photon rays or those light rays are penetrating or being penetrated to your immune response. So that is causing a very permanent damage. At first what we see, that is the apparent or the external exposure, but here the things that are happening that are causing your immunity depression or it is causing the immunity damage. So that is very much concerning, and here the names of the drugs, that is sulfonamide, sulfonylureas, grasofulvin, then chloroquine, chlorpromazine. These are the examples cited. So first we started with that photosensitivity, the classification, that is two types, phototoxic and photoallergic. So this way we can say that how photosensitivity is involved in the categorization of the adverse drug reaction. Next is the drug dependence. Now you all know the term itself, you can get the meaning of it, like drug toxicity, drug dependence. That means what? There is a dependency or there is a helping or there is a dependent on the entire drug molecule. There are many patients, often you will see, they are totally both mentally and physically they are dependent on these drugs. So let's move on to the what is being written here. Here it is said that Drugs that are capable of altering the mood and feelings are liable to repetitive use to derive euphoria, withdrawal from reality, social adjustment, etc. So this is a very vital point. What happens here? We can see that due to this drugs, the people or the patient, you can say, not people, the patients are so much dependent due to their repetitive use. It is not a single time or a dual time or a triple time use. It is a repetitive use, which results in what? Euphoria, then withdrawal from reality, and social adjustment issues. So such type of problems are being caused. Next, what happens? Psychological dependence. Psychological dependence is what? So here now the drug dependence we are categorizing into two basic types, that is psychological and physical dependence. Now psychological means your mental dependence. So what we have written here is that individual believes that optimal state of well-being is achieved only through the actions of the drug. Means what? If you think that without this drug I can survive, or without this drug I can resist, then only you can get over to this dependence. But if you can't think in this way, it will be very difficult. And a very good example has been provided, that is opioids, cannabis, cocaine. Okay. Next is the physical dependence. For physical dependence, what is said that altered physiological state that is produced by repetitive administration of a drug which necessitates the continued presence of drug to maintain the physiological equilibrium. So discontinuation of the drug results in the characteristics withdrawal syndrome or the abstinence syndrome. Means he or she, the patient, is so much physically dependent as well as mentally dependent that on withdrawal of the drug, or when the dose or the regimen is being stopped, what is causing? It is causing a withdrawal syndrome, or it is causing a abstinence syndrome. So let's look forward. What are the drugs? That is opioids, barbiturates, alcohol. Alcohol is a very good example. Benzodiazepines. So such types of drugs are creating dependence. So what is drug dependence? What are the various types of drug dependence? Psychological dependence and physical dependence. Now with this same point, that is drug dependence, another point is drug abuse. So previously we got, let me highlight the points so that you can understand. First is psychological dependence. Next I said physical dependence. And then it is a drug abuse. Now this drug abuse is also a broader aspect. It includes drug abuse, drug addiction, drug habituation, and habituation addiction imply. So, which means what? This drug dependence also includes this four more points, that is drug abuse, that is misuse or exploitation use of drug. What is written here? The use of drug of self-medication in a manner and amount that deviates from the approved medical and social patterns given in a culture and time. So drug abuse refers to any kind of illicit drug. So the basic key point here is, it is the refer of an illicit drug. Drug addiction, compulsive drug. See, the terminologies that we are using is very necessary because the terms are very known to you. Drug abuse, drug addiction, drug habituation, habituation and addiction imply. But what is that? It is the illicit use of drug, or drug addiction means a compulsive use of drug which is characterized by the overwhelming involvement with the use of drugs. So such things are very important to know. And next is what? Drug habituation. Less intensive involvement with the drug. Withdrawal produces only mild discomfort. So here the term is withdrawal. So habituation is less. It is not that intense, but withdrawal symptoms can be seen. So that is more prone. And the last is what? habituation and addiction imply, which includes the different degrees of the psychological dependence. So here we have seen that in the drug dependence, we got a broad classification of psychological and physical, and apart from that we got another 4 points, that is drug abuse, drug addiction, drug habituation and addiction imply. So these are the entire thing that is very easy, but what is there, you have to understand and remember the key words. That's it. So this way how drug dependence is included within the categorization of Next is the drug withdrawal reactions. As of now, in the previous you have heard this term many times. Drug withdrawal is causing problem. Now let's see what type of problem it is causing. So here you can see that sudden interruption of the therapy with certain drugs may result in adverse consequences in the form of, so here adverse consequences is the key word. Then here interruption of therapy is the key word, and what is causing? Worsening of the clinical condition. So these are the key points. What is interruption of therapy, adverse consequences and worsening of the clinical condition. So here I have cited some examples. Corticosteroid, that is the adrenal insufficiency of beta blockers. Worsening of angina. So now corticosteroid causing adrenal insufficiency. Next is beta blockers, which is causing worsening of angina. Then prediction of MI, that is myocardial infarction by clonidine, and clonidine causing several HTN, restlessness and sympathetic overactivity. So here you can say corticosteroid is causing what? Adrenal insufficiency. Beta blockers causing worsening of angina. Then precipitation of myocardial infarction. Clonidine causing severe HTN and the restlessness, sympathetic over the activity. So these are the conditions that are causing due to drug withdrawal reactions. Next is the teratogenicity. Now what is teratogenicity? Teratogenicity is the capacity of a drug to causes fetal abnormalities. Teratogenic means the fetal damage or the fetus damage. When does it occur? It occurs in cases of pregnancy when a mother is pregnant and the mother is provided with the medications that causes the adverse drug reaction to the fetus that causes the teratogenicity. So here you see what are the steps how the drugs can affect. See, this is the very important how drugs can affect. Fertilization and implantation stage, the drugs can affect. Organogenesis, when the organs are developing of the fetus, that can affect. And the growth and development of the fetus, that also can affect. So in these 3 phases, the drugs are affecting. So let's look into the very prominent example, that is thalidomide, which causes the phocomelia. Often you have heard that in Africa, this teratogenicity has occurs due to certain nuclear explosions. That is the abnormal fetal growth or the malformation of fetus for many of the pregnant women. Okay. So here it is occurring due to the drugs or harmful chemicals. Several anti-cancer drugs are there. And what is ACE? ACE is the angiotensin converting enzymes. So those also causes the harmful effect on the lungs and kidney. And the main 3 stages are during fertilization and implantation, that is during the conception to 17 days. Next is the organogenesis, that is 18 days to 55 days, that is the organ development of the fetus. And the last is the growth and development, that is lesser than 56 days, where the functional abnormalities of the fetus can be seen. So here the drug withdrawal as well as the teratogenicity are also included in the categorization are being provided.